Hello, I'm Molly Kilcullen, and you're listening to Voice Crack, the podcast where I speak to training actors and medical professionals all about the voice. Today I'm speaking to Tori Burnay. Tori is a voice specialist and speech and language therapist who works extensively with singers and professional voice users. She's a clinical expert in voice disorders and the clinical lead for the NHS Voice Clinic at Guy's and St Thomas Hospital. Tori and I first met in April 2022, and since then has been my absolute saving grace in my treatment for my nodules.
Welcome. This is Tori Burnay. She was my speech therapist for all those months when I had nodules. If you want to tell us a bit about yourself, Tori, that'd be great.
Hello. So I'm Tori Burnay. I am a speech therapist. I specialise in voice disorders, and I think what most people don't realise is that speech and language therapy, it's a little bit like medicine in a way, or like other sort of therapies, is that you train, but actually you do specialise, and there are lots of different areas to specialise in. So I qualified about just coming up 30 years ago. Spent about the first couple of years doing general practice with children and adults, and then worked actually in neuro rehab. So I've got a background in neuro rehab, neurology, stroke, brain injury, this sort of thing. I did for about 8 years after that, and then I always did a bit of voice. And I came to working in voice, the voice specialism about 20 years ago. So I've just worked in voice for 20 years. It's quite a long time, isn't it, in the grand scheme of things? And so these days, certainly, I suppose in the last maybe 6 or 7 years, I've become more and more specialised working with performers and people training in performance. I've got a bit of a background myself, so it sort of gives a bit of an interest. But certainly professional voice users, and that would include, I suppose, not just singers, actors, stage performers, but also people who use their voices professionally. And these days it's a lot of people, but definitely performing voice is my kind of thing. And I work at Guy's Hospital, and that's in London. But I also run a very busy private practice now with a couple of associates. So I see a mix of people in my private practice, but that's how you and I came to meet.
Yes.
And that often happens because people are seeking very specialist support and advice from ENT doctors who are also specialists in voice, and they would be called specialists in laryngology. And we'll probably come and chat about that a bit later. I think you've got Mr. Costello in your series of interviews, who was your laryngologist, but finding a good laryngologist specialist, not a general ENT surgeon, if you've got an issue, that's really what we would advocate, is really, really important. So that's me. So that's what I do. I manage a team of about 7 speech therapists at Guy's, and I manage 2 other people in a small private practice, but it's very busy. Lots of people with vocal issues. And that's what
That's the thing, isn't it, really, though? It is a lot more common, than I ever knew. And, I think when I came to you, or even when Declan told me first, I was like, what? I have nodules? And I had no idea. But then once you told me that you see so many people, or even, you didn't even have to tell me that you were seeing so many people. You would just say, oh, I had a guy earlier, or I've got a person later. And I'd be like, she must just have loads of people. It's so common, and the way you and Declan were actually so calm about it made me relax so much, because obviously I knew nothing, and that was that's the worrying thing really as well. And then you Google, and that's never really the right
Google,
because there's different types, isn't there? You've got, what is there, hard and soft nodules. And
yes, I mean, I think for you, I think as a young person, actually, and actually nodules, the diagnosis of nodules is it's sort of the thing that performers and singers fear the most. I think it's because it's just the thing that people hear about.
Yeah.
Actually, there was a nice piece of audit. That's when people go back and look back at all their records, and they look at numbers and figures. And the team in Lewisham Hospital, who are great, very performer specialists that we work alongside and collaborate with, Like I said, guys, they've got a big database where they go back years and look, and they have a lot of singers referred there because they're also interested in working with performers. So they looked at all their singers that were referred over several years, and they grouped them into their diagnoses. And nodules in the singers group was really small. It was something like 4 point something percent compared to all the other things.
Yeah.
So it's not even that common. But nodules is very much an overuse. Overusers, overdoers. We don't see vocal fold nodules in people who don't use their voices a lot. See it we don't see it in shy, retiring, quiet folk. We sometimes see it with people who've got a lot of chronic cough, irritable issues. So we might see it in people, but it predominantly tends to be focused on the younger age group. We see it much more commonly in young children who do a lot of yelling and shouting, and maybe involved in those sports. And I suppose I see these sorts of issues in younger students often coming into performing arts courses who may have done a lot of performing and or sports, or going out and shouting a lot, or also working in bars and clubs, to also boost income.
Yeah.
People will generally have said, I've always had quite a loud voice, I've always been the life and soul, or they've just done a lot of maybe musical theatre training in their formative years, where they will sort of maybe reflect back like, well, yeah, I probably was just yelling, I probably just, shouting. A lot of people talk about the start of voice issues with nodules where they were perhaps a bit poorly and to go on in a show, or they did something, and their voice went and they kept going and going and going and going, and they didn't know about the fact that they probably needed to go and see someone then, or reduce their load, that sort of thing. Yeah. We do see nodules in a very experienced performer group. Sometimes it's just to do with excessive work schedule. Sometimes people touring, people doing a lot of intensive singing in a week or 2 weeks, where they might be recording or rehearsing for shows. These sorts of things that can just start it. And it's not necessarily, they used to be called screamers nodules, singers nodules. It's implied as poor technique. And so there's sort of real guilt and shame that people have. But actually, we know that it can be associated with overdoing it, being a bit loud, shouting and screaming above music, all these sorts of things. Yeah? Or it can be just to do with the fact that you were having to do something and you weren't so well.
Yeah.
For whatever reason.
Because we kind of whittled it down in my diagnosis to this. There was a lot of like harsh pressure, pushing, loudness, like basically the recipe for not disaster, but some kind of issue.
A reaction. Yeah, a tissue reaction, actually. A tissue reaction. The thing about it is that we'll have all experienced, generally, we'll have had a cough or a cold, something, or real laryngitis, where you're sick and you feel uncomfortable and sore in your larynx and your voice goes off, or you just have a stinky cold and your voice is a bit deep and dry, that sort of thing. Other people might experience hay fever, where they get really bad hay fever, they've got allergy and they can feel everything swollen and sticky, and the voice is also affected too. Anything that creates swelling. But once a little bit of swelling and irritation, what happens is if you try to keep making the sound loud and you keep going, is you just get a little inflammatory response, and it's always in that middle part of the vocal folds that takes the force of collision. So if you kind of get louder, the worse the voice gets, we tend to drive a bit more to get a better sound, and it just becomes like a little cycle. So there are ways that there are things that we sort of look at with nodules. Nodules is kind of a sort of a later stage of what we call hyperfunction. People are overdoing a bit, and then the nodules, they do take time to come. You don't get nodules overnight.
They don't just
No.
Yeah, because I remember when I actually because obviously I didn't have started in September, and then I don't think I went to see. I don't think I had an appointment with Declan until like November. So obviously for that whole time, like loads of people knew I loved to sing and stuff. Molly wasn't singing or speaking that well. And then it was like, so but it actually was all that time. And then it was like, no, you actually do have nodules. And there was some kind of relief in knowing there was something. We knew what it was. But then I was like, what next?
Yeah. What
But
do you
it
do?
actually ended up all being completely fine. And our first meeting, you were like, not doing so much. Because I think I was like going to school, then going to the gym, and then trying to eat, and like sleep was just a massive thing. I didn't realize how much I needed. That's like the bread and butter, really, sleep and hydration. To
Yeah,
it,
do you
because
remember why sleep's really important? Oh, I'm asking you now. Why is sleep important?
because it's because once you use your muscles, they need time to relax, and don't they recover when you're they recover when you're sleeping.
Yeah, we do. We get cell repair, cell regeneration when we're resting, when we're sleeping. Obviously, you're not using your voice unless you're chatting a lot in your sleep. So,
Yeah.
so that's good. Yeah, it's kind of, when the surface layer, the sort of vibrating layer of the vocal folds is made up lots of collagen and fibrin fibers. And so the vocal folds are made to vibrate. They're supposed to vibrate. When they're vibrating with force or there's some inflammation, then we have to have a period of time where we're resting the voice. But actually what we've discovered over, science has moved on a bit from, 20 years ago, or really 30 years ago, I suppose, or more, is that what we know now is that vocal rest periods really help, but actually learning how to use your voice with improved mechanics to create a full total sort of contact to the vocal folds when you're voicing, and then you combine that little rehab exercises with the rest and with these sorts of things. That's what helps things to improve. Vocal rest will help. Lots of people are on vocal rest, as you were.
Yeah.
But actually, you weren't on vocal rest. You were just on sort of singing rest.
Yeah.
And we kind of had to work out that. But the sleep and the rest and repair for anything is that is really important. Yeah, I remember very clearly our first session. You were absolutely exhausted, and they just changed locations or something. So suddenly you were having to travel for an hour.
Yeah.
And you were absolutely wrecked trying to do it all, and we just had to kind of reframe how to give your body time to start to have healing time and downtime, because actually what we found with other students is that it's the first time, even if you've done a lot of stuff. Some people haven't done much at all before they start the course, but if you've done a lot of performance before, it's not quite the same as being full-time in these courses that are also very physically demanding. If you're dancing, also you're in acting classes, movement classes, dialect, acting through whatever the course demands. Vocal load and very long hours, and people are shattered. And actually it's sometimes it's then when people in that first couple of months it can be quite frequent that people start to feel these sort of vocal fatigue symptoms and voices not working so well. And it's kind of, the tutors it's sort of looking at the timetables. I know there's one or two courses in the country that sort of pride themselves on being the most intensive and having the most hours for training, and actually it's not really taking into account that actually people need to get home and eat and wash their and do their essays and prepare and actually have rest time. It's good for health,
Yeah, I think that was the thing with first year, like with our course anyways, like it's skills. I think, well, I don't really know for the other schools, but like it's skills, all skills mostly is loaded into your first year. And then gradually, like I'm kind of seeing the workings of the course now, but gradually as it goes on, you get like less skills, and you get to actually put them into practice for like shows and stuff. So like first term there we had 2 full days of rehearsal and like 3 days of skills, but we'd have more breaks, which is more, it's meant to allow for more rehearsal time and stuff, or rest. And then this term we just got our timetable staying. I start at like 2 on a Monday, like into singing, but before that, like we'll have time for like rest or rehearsals, and same with the Friday. So it's nice progression as the time goes on to go, okay, like you've given us all our skills, let's try and put it into practice now and rest properly. And because like that's part of professional practice as well. You have to know yourself when to stop, or when you've had enough. Or like I find out my voice is my biggest teller for how I am feeling. Like just like as soon as I wake up, or like anything, it's just it's mad. My clock is so much with other people now as well. It's so bad. And like I said to my cousin the other week, I was like, God, your voice, you want to look after. And she's like, what do I need my voice for? And I was like, fair enough. And like, you know, you just get over the hoarseness, whereas I'd be like, nope, stop talking, sleep, steam, water.
Well, yeah, but you know, your vocal health is so important because it's got your instrument, and you experience what it's like to actually, you know, when you've got some issues with the voice, quite often what happens is your vocal flexibility for displaying range and emotion, never mind singing and access, all that, you know that it diminishes. So it reduces to a point where it actually becomes quite effortful to speak and exhausting, tiring. People can get pain, they get then all tightness, you know, everybody's working hard. Remember, we worked a lot about reducing vocal effort and moving the voice about, and you were going, oh, it's so much easier. And I said, yeah, because if you're like this all the time and pushing and loud, it's sort of everything's sort of fixed, you know. You sound great today, by the way.
Thank you. You were saying
so yeah, I do think that you know, you're surrounded by lots of wonderful tutors. I think and I think these days, well, always people have been supportive of vocal health and understanding, but you know, I think we've still got in some places students walking around with I'm on vocal rest badges on, you know, and they're just put on eons of rest. And actually what we want some of that, but what we want to do is, you know, have some links with clinics or, you know, people that really understand when to refer. When does someone need a referral to ENT?
Yeah.
They who takes responsibility for that health? And actually what you were talking about then, and I think that's what we really are pushing for all the time actually in the working world, is nobody's really going to safeguard you and your voice except for you. You have to totally take responsibility for that. And there are places to go and seek information. This is going to be one, you know, for you. And, you know, I always say, okay, well, let's make good use of a small crisis. Because what happens now is that you maybe wouldn't have had all that education in mind. I don't want to be your tutors and your cause, but you may not have had it in the amount of information that you did.
Yeah.
And you won't forget that. You take, you know, now you take for granted, oh, I might do a rest, I'll do a steam, I'll work that, I'll get do my CVT, I might do my access. You know, you've got tools now.
Yeah, definitely.
Help you to reset, and also not just tools, is that, you know, that exercise helps me with this, that one helps me with this. You kind of know what we call it the rationale, you know.
Yeah.
Why am I doing that? You don't just rattle through to 8 exercises for the sake of it. You think, I feel a bit tight, I need to do some stretch and release, but otherwise I'm okay. Or I'm feeling fatigued, but I have just used my voice for 8 hours straight today. That's normal. I just need to go to bed.
Yeah, that was a big thing as well of me kind of going through the recovery thing of knowing, okay, what's normal now? What should I normally be feeling? And I remember you said to me something like, I was like, oh, obviously I'm still a bit hoarse in the mornings. And you're like, nope, I don't feel like that. And I was like, right, okay, and then that was like the next thing to be like, okay, can I in the morning do a siren? And then it was like, once I got to that, I was like, okay, right, something is healing. Something is going down now. And then, but yeah, I didn't even think about that. Like, you literally gave me like a suitcase of all these tools to use. And even, oh God, yeah, because I can now, like, I hear it in like people in my year, if they've all kind of got this thing, sometimes they'll get very phlegmy. And I guess that's that poses the question then, like, how long do you wait until you go in to see someone? Because obviously mine was very obvious. It was like hoarse,
very husky,
and breathy and a lot of effort. Whereas some people are fine, but then when it might be like when they come to sing, they find like they're really phlegmy and stuff. And some people have cut out dairy and stuff before they're going to sing, but it's like,
well, let's talk about phlegm then, shall we? Is that something that's come up? Mucus.
Yeah.
sort of say phlegm is sort of from your chest. So we'll have a group of students who maybe have things like asthma, have underlying respiratory disease, yeah, asthma, maybe allergy as well, combined with that. Okay, so there'll be people that, you know, suddenly now are starting to get hay fever because we've hit April. And actually need to take an antihistamine, or actually these days, if you really do have seasonal hay fever and your nose gets blocked and itchy and you feel your throat's a bit claggy, we have a really good nasal sprays. Now, you can ask Mr. Costello about nasal sprays for hay fever and managing allergy. If people have a really bad allergy, actually, you can even ask now to actually, you know, you probably want to get what we call skin prick testing or a blood test, which is called a RAST, R-A-S-T test, where you screen for the major allergens like pollen and grasses and dust mite and all these sorts of things. So you can either have it pricked into your arm and you'll see what happens.
Oh, yeah.
Or you go off and have that, but you can have immunotherapy where you have that over 3 years, and they might give you injections, or they might give you a little capsule of the thing you're allergic to if it's pollens, things like this, and that builds the immunity, and it works really well. The reason I'm chatting in quite a lot of depth about this is there will be people, maybe your colleagues, who will have they are very allergic to things. The food intolerance group's a little bit here, but it can be looked at as well. But it's sort of really understanding about other sorts of allergies that create a lot of mucus. You will see if you on Twitter or other sorts of places, you'll see West End performers, what have you, going, what the heck's going on? I don't even know what I'm going to wake up with today. The allergy is so terrible. They're taking this tablet, the nasal spray, it's antihistamine steroid, is really good. Sometimes the tablets can dry people out a bit. You know, it's really worth working that out. So if people have a bit of low grade allergy, even to dust and dust mites, which people do, or animals, we talk about things like washing your nose out. I don't think you ever.
Yeah, the squirting.
Did you do it with the squirting thing? Neil Med is one make. I don't have any links with any companies, just to say, no affiliations. But you know, you put little salts in a little sachet of salt, and it's boiled, cooled water, and then you gently have to kind of lean over, you sort of washing out your sinuses. You do that morning and night. Ideally, if it's pollen related, you kind of, if you go out when you come in, you do it then, because it's when all the little particles are in your respiratory system. It's in your nose. It reduces the nasal drip, which then also can really irritate the larynx and throat, and it really makes people a bit swollen or a lot swollen and really sticky. Okay, so that's a mucousy thing. Dairy, there's a nice piece of research that showed that if you believe you get sticky with dairy, then you're more likely to be sticky. And if you believe it, then you're not. Unless you have asthma or COPD, any respiratory thing, when we know that in a lot of cases, for some reason, it does make mucus more sticky. Fascinating, hey? Just as much as coffee isn't necessarily a massive dehydrator. Of course, if you're drinking 5 double espressos, not great. But coffee will affect people on a hydration and a caffeine sort of metabolism sort of level very differently. Some people will be very sensitive, can't have a coffee after 11 o'clock because they're awake late at night. Other people can have a coffee and go to bed. It really depends on how sensitive you are. Alcohol, we know, can make you dehydrated and sticky, and we absolutely recommend avoidance of smoking, and really importantly, vaping, because of the enormous vaping explosion in the young population. And actually smoking now, I hear, has really gone, it really dropped. Vaping went up, now it's all gone up. And we know that there's a really strong link with sticky, dry surface of the larynx, certainly with smoking when it's hot, but the vaping can create really big problems. And so you are struggling with mucus and sort of fatigue and dry throat and these sorts of things. If you're vaping, it's just an absolute sort of madness, really. Now, I always say, you know, when you prioritize your voice over the feeling and the need to smoke, you know, that's the thing. And if you want to perform and do that, we know lots of people do smoke, but it's not helpful. It's really not helpful. So that's like the other bits that influence the stickiness. The big thing that will make you more sticky and phlegmy is dehydration.
Yeah.
Now, usually when people are dancing and performing and doing stuff, they're necking loads of water. It's more difficult in winter. If you're on an acting course, often less so. Depends on you, but actually that really, really helps. And we say 1.5 to 2 litres or a gallon of water, but it's like 8 cups. It doesn't have to just be water, but we want non-caffeinated, non-alcoholic liquid.
Yeah.
Some people get more sticky if they drink fruit juice. Seriously.
Oh, yeah.
Apple juice is better, but apple and orange makes you really claggy. So that's like what makes you claggy? Definitely alcohol, because it really is dehydrating.
Yeah.
So if you've got a big show coming up, don't drink loads and smoke loads the night before. We haven't talked about smoking other things, but obviously that will affect your throat. Now, there's an interesting thing about feeling more mucus when you start to use your voice, isn't there? There are a couple of things. I find that if you start to do things like getting the warming up and getting breath moving, you might feel that you're a bit sticky just because you're getting everything moving first thing. Yeah. So when we're doing sort of some of that airflow, you might, oh, I sort of got things moving. And I think that can be quite normal.
Okay.
If you start to feel that you're producing more mucus though, and you feel more mucusy and a bit hot and what have you, while you're in the middle of singing, what it tells me usually, allergy aside, is that it's quite likely that you're overdoing things, you're overdriving in the larynx.
Yeah.
And what happens is the body starts to produce a little bit more mucus to soothe and calm the tissue. Yeah. So if you've been belting a lot, or you've been doing high intensity singing, and it's a bit irritating, or you feel I want to do that. It's the same sensation that we get when we're out talking over background music for long periods. If you're out in a club or a bar, you similar sort of feeling after about half an hour. So you need to kind of be careful. I definitely will have people I work with that will say, I sort of just get into the zone of working, and it's very high, and they're very high intensity singers. It feels more mucusy. It tells me perhaps they're working a bit too hard, and there's something about the balance there.
God, it's so interesting because, like,
I mean, I've covered lots of bases, probably not everything, but
no, that'll answer more than enough questions. It's just, I just find it so fascinating because then obviously I'm obviously so careful now. Like I don't sing unless it's like an ABBA song and it's one like, but I genuinely now I just don't. And I remember when I was first diagnosed and whatever, I was like, oh, I don't want to stop singing. I don't want. And I was like, actually, it doesn't matter. Like in the grand scheme of things, it doesn't matter if you're cutting back on these things. If this is what you want to do, like this is your tool. You need this long term and to look after it. And then once you kind of figure out the balance of looking after that, it does literally just change the game. And even the way like some people ask me now, they'll be like, oh God, I'm so phlegmy. And I'm like, oh, the first thing is like, oh, have you drank enough water? And they've all got these massive like water bottles they have to like get through in the day. And I'm like, oh, well, I don't know, maybe there's something, maybe because like, you know, if there is mucus and stuff, I kind of knew that is a sign of some little bit of swelling or something maybe, but obviously I'm not going to say anything to anyone.
But not always. I mean, sometimes, you know, they just need to do a bit of steam inhalation or cool mist because they're drinking water, but it's not going inside. Sometimes people actually genuinely are having some problems with reflux. They're eating too late, they're lying down, you know, and it can be one of the symptoms. People will say they feel like they're a bit more phlegmy and mucusy, and it might be just that they went home and had a bowl of cereal and went to bed, and maybe that affects them that way. But I just think, you know, it's an interesting one to know, you know, understand how hard people are working.
Because I watched actually like literally just a TikTok video yesterday of this girl called, I think she was the cover for Eponine in Les Mis, but she had been sick for a week, and so I think usually she'd be in the ensemble, but then obviously had to go on, and then then people like in the TikTok comments and stuff were like, oh, what do you do when you're sick? So she did a video of her like with her, she was steaming, she had lemon water, and then she was doing like the straw, is it the
tube exercise? Yeah.